5 years ago, COVID-19 was first reported in China's Wuhan, and years later, the question still remains if the world is ready for another pandemic. The ongoing spread of a novel bird flu strain, specifically the H5N1, is causing alarm among public and animal health officials across the U.S. as it continues to infect various species. The spread of the strain has raised concerns that the virus could mutate into a form transmissible between humans, potentially triggering a pandemic which could bring the world to a halt in a similar way it did years ago, when COVID-19 surfaced and wreaked havoc. The National Public Health Agency of the U.S. reportedly found bird flu mutations in a patient in Louisiana. CDC said in a statement that the Louisiana case of bird flu marks the first instance of severe illness that's linked to the virus within the U.S. As the situation evolves, the agriculture and health communities remain on high alert, working to mitigate the impact of this potentially devastating virus. The recent detection of H5N1 in commercial pigs on farm in Oregon marks a significant development in virus spread. Recently, the CDC announced on December 18th the first severe case of H5N1 in the U.S. That patient had been exposed to sick and diseased birds in backyard flocks, whereas a notable case of a child in California marks the first reported instance of H5N1 in a U.S. minor. Meanwhile, National Health Public Agency of the U.S. has reported that the current risk to individual and population health remains low and has not significantly changed from the most recent assessment done on a similar H5N1 virus that caused an outbreak among mink in 2023 in Spain. According to a study published in the journal Science in early December, the virus strain found in dairy cows in the U.S. may only need one mutation for it to be able to spread among humans. CDC continued to emphasize the importance of stringent biosecurity measures to manage the spread of H5N1. These include enhanced surveillance, immediate culling of infected stocks, and ongoing public health advisories to limit human exposure to the virus.